Hi, I'm Itesh Jeff, and this is In Conversation with the Masters. However, from this episode, the show will now be called Luminous Wisdom. And today I am having a conversation with Dr. Ashmika Gokhul, who is a specialist pediatrician. And Dr. Gokhul has been on the front lines of the pandemic of COVID-19. And Doctor, thank you so much for making time to have a chat with us today, as well as for all the great work that you are actually doing.
Good evening, Hitesh. Thanks for having me on your show.
So, I just want to put everybody into context here. We are from South Africa, and in our country, we have a lockdown from levels 1 to 5, or 5 down to 1, where 5 is the most strict, where 1 is the most lenient. And currently, we are in a advanced level 3 at the moment in South Africa. Now, Doctor, at the time of actually doing this recording, of having this conversation, we currently have about 140,000 cases in our country, South Africa, with about 2,500 deaths. That works out roughly to about, say, 2% of a mortality rate. In my mind, it doesn't seem like it is much of a pandemic. It doesn't seem that that is cause or reason for us to have such fear. Because if you look at some other numbers, for example, just last year, we had 90,000 people die from just diabetes. We had 63,000 people die from TB in 2018. The same amount of people were actually murdered in that year. And I also know that in this country, 1 in 6 people have some kind of cardiovascular disease. Now, I know that CVD and as well as diabetes, they are not infectious. But still, surely context and perspective is everything. Is the fear really warranted? Do we have a real pandemic on our hands? And why are we ignoring all of the other sicknesses that we have?
Okay, so Hitesh, I don't think as a medical fraternity we are ignoring all the other diseases that are there. But I think we have to make it clear that this pandemic is real and it is serious, okay? Globally, there are more than 10 million positive cases of coronavirus, okay? And you've just mentioned the statistics that we have currently in South Africa. The numbers that you have quoted with regards to infectious and non-infectious diseases, actually annual figures from last year. This pandemic is currently only going on for 5 months, and by the end of next week it will be 6 months. So I don't think that we can compare SARS coronavirus or COVID-19, the disease that it causes, to any of the above. It is very infectious, okay? And whether the fear and anxiety around SARS coronavirus or COVID-19 is warranted, I think not so much fear, but I can understand the anxiety both in the general population as well as in the medical fraternity. Okay, SARS coronavirus 2, as you know, is a novel virus. Up to date, there's no cure for the virus and there's no vaccine currently available. Okay, we are all still learning about the actual pathogenesis of the disease and how to manage the actual disease. Okay, in the medical fraternity as well. As I mentioned, I don't think there's so much of fear, but there's a great deal of anxiety even amongst ourselves. As much as we tried to prepare ourselves as best as possible, we come to work every day putting on or try to put on the appropriate PPE or protective gear that we have. We know at the back of our mind that every patient that we come into contact has the potential to infect us with SARS coronavirus 2. And some of us may not experience severe disease or may just have mild disease if we do become infected, but we also pose the risk of taking that infection home to our families. And some of the people in our families may be more vulnerable in experiencing the more severe complications to coronavirus or SARS coronavirus 2 and the disease COVID-19. The good news for me as a pediatrician, though, or for all of us as pediatricians, is that children don't seem to get infected as much as the adult population. And for some reason, even if they do become infected, they actually don't experience such severe disease. So we don't know the exact reason. There are quite a few postulates regarding this. But I think as a pediatrician and for all the parents out there, I think that the fear and the anxiety that they have regarding their children is not warranted based on the statistics and the experiences that we have had both internationally and locally. You also spoke about whether the regulations or the current lockdown was warranted. And I think, yes, our president was very decisive in putting out rules and regulations quite early in this pandemic. And we were all for that because remember, our private healthcare facilities as well as our government facilities were never built for pandemics. So the infrastructures of most of the hospitals will not allow for us to isolate and manage these COVID-19 patients. So the initial lockdown was actually good in a way that it allowed us time to prepare our hospitals and our facilities. It allowed us time to get the appropriate PPE and equipment. It allowed us as individuals, as healthcare workers, also to prepare ourselves in order to manage and cope with these patients with COVID-19 and also to make arrangements for non-COVID-19 patients as well.
Okay, let's try and slow down a bit because there's a lot that you shared there. I think from that itself, I think I have 1,000 questions to actually ask you. But just on that last point, right? You said that we actually were not prepared for this, for a pandemic. I think that the human race, human beings have been around for a long time and we've seen many pandemics throughout the years, hundreds of years. Why have we not learned from our past? Why did we not have a plan in place? Because if I was running a company, I would make sure that if anything is going to go down, whatever it is that any problem that can actually happen, I'm going to make sure that there is a solution to it. How come the whole world was not ready for something like this? Why did we at least not have a plan?
Well, unfortunately, I'm not the best individual to answer that question. I think we have to take into essence this pandemic in totality. So I can only speak from experience from a healthcare perspective, but obviously this affects all of us in terms of our socioeconomics and politically there's great effects that this pandemic has had on the country and why our country or other countries have never prepared for pandemics. We were exposed to H1N1 before, the SARS coronavirus 1, MERS coronavirus before, which is very similar to the SARS coronavirus 2 that we currently have. In the 1930s, there was the plague. There were so many different pandemics, but unfortunately, I'm not the best individual to answer this question.
Okay, so let me ask you about kids, because I know that is what you specialize in. To an ordinary person, it would make sense that kids would probably be more vulnerable to this COVID-19 because it's attacking the immune system, right? And I would think rationally, like just using pure logic, not science, that the kids' immune system has not been developed. Why is it that kids are safer than the adults?
Okay.
Because now we have kids actually going back to school and parents are really worried about the kids. Should they be worried, or what's happening on the inside of the bodies?
Okay, so no one really knows the answer. Okay, there are postulates about why kids are not as infected as adult population, and some of them are around the fact that in terms of coronavirus as a family of viruses, there's 4 common strains that we've previously been exposed to, and kids commonly pick up those 4 strains of coronavirus, which causes common cold symptoms. So maybe their immune system has adapted and there's memory cells to that. So when they actually have been exposed to SARS coronavirus, they're actually familiar with it and able to respond better and therefore don't experience such severe disease. But in actual fact, we don't really know. It could be that the actual SARS coronavirus has a spike protein and it attaches to the ACE2 receptors. There are postulates that maybe the way the ACE2 receptors are portrayed in kids are slightly different to that in adults. We don't really know the actual answer. The good news though is that kids do really, really well, even if they are infected with SARS coronavirus. In saying that, they are children who may be more at risk of developing severe disease from SARS coronavirus or actual COVID-19 disease. And that is very similar to that in adults. In those children that are severely immunocompromised, either from having cancer such as leukemias or lymphomas or others, children that are immunosuppressed from being on immunosuppressant drugs depending on the diseases that they have, chronic lung diseases, critical cardiac diseases, those children may be more at risk because their immune system is slightly lower. But like I've mentioned already twice before, no one knows yet. I mean, we're still learning about SARS coronavirus 2. We're still very early in this pandemic, and I'm sure later on by next year we'd have a lot more answers to that.
Let's talk about creating a vaccine for this. First, let's answer this question. Is this like the flu? Is it worse than the flu, or is it like a super bad flu?
I don't think I would even compare it to even a super bad flu.
Why?
Okay. So the symptoms that people experience once they're infected with SARS coronavirus is very similar to flu or the seasonal influenza that we have, but the rate of infectivity is much, much higher. Okay. You've quoted stats before this, and I said we're only 5 months into this pandemic. We cannot compare it. Okay. SARS coronavirus, majority of the population that becomes infected with it, 80% of those that are infected usually will have very mild symptoms. Okay, they can stay at home, self-isolate, and get over-the-counter medication and actually do very well. The other 20% of individuals that are infected with SARS coronavirus have much more moderate or severe disease, and around 5 to 6% of that population may end up in the intensive care unit, where they may need invasive or non-invasive ventilation or other modalities of intensive care. Okay. I forget the question that you initially asked. Why can't we compare this to SARS to influenza?
Yeah, I'm just asking, is this like the flu? And you say no.
No, definitely not. We cannot compare it. The numbers are going to rise. I've mentioned the global figures currently. We're still 5 months into this pandemic. Initially, when the lockdown had started, we were seeing very few cases of SARS coronavirus, but now it has spread in the communities. Okay. We are currently, during this week, we've actually experienced I have admission rights at 4 hospitals, and I mainly admit at the 2 hospitals. So we get the statistics from both the hospitals. This week alone, we've actually seen that there's been a massive rise in positive patients being admitted with SARS coronavirus. So our surge has started in KwaZulu-Natal. We've been seeing it in the media, what's happening in the Western Cape, what's starting to happen in Gauteng, and now in KwaZulu-Natal.
All right. Okay, so let's just say that this is not like the flu, as you are saying. But you would agree that this comes from the same family of viruses that actually make us sick from the flu, right? So
no, I have to disagree.
Okay,
but
right.
The seasonal influenza we see is influenza A and influenza B, and it's been around for a long time. We even have vaccines against it, which changes every year because of the mutations in the in the actual virus. It is a virus, but they come from a different family of coronaviruses.
So is it not a coronavirus? The flu.
No, it's different. It's influenza. Coronavirus is separate. It's like how you get different viruses, like enteroviruses, respiratory syncytial viruses, adenovirus. They're all different viruses. Yeah, it's like having different fruits.
Yes. Because I was going to actually ask you then, if this virus is actually going to mutate somewhere down the line, what value is having a vaccine then?
Okay, so currently I think the last time I heard or checked, there were about 200 different vaccines that are out there, but there are only currently 15 that are being trialed. Last week, South Africa at the Wits University started one of the coronavirus trials. I think what we're all waiting for actually is a vaccine or somebody to come up with some sort of cure. There are different modalities of treatment that people are coming up with that assists with us managing the more severe cases of SARS coronavirus. But what would really assist us in this pandemic definitely is a vaccine. Now, with any vaccine, what happens is you either introduce an individual to either a portion of a live or a dead vaccine or something that's synthetically engineered. With I think we're very fortunate that up until now, there has been no mutations that have been seen, especially with that spike protein in the SARS coronavirus. So if this remains true, then actually there'll be no mutations, and the vaccine would be very good, because it will actually, we don't know yet how people are going to respond to the different types of vaccines that they're currently out there, but it will mount an immune response in that individual once they've been exposed to this vaccine. And it will either decrease the severity of the disease or actually stop disease in total. We don't know. We'll have to wait for these vaccines to be trialed and see what comes of it.
Can you tell me why half of the world population that are actually getting infected with this COVID-19, why are they recovering? What is so special about that group of people? Is there something that they have in their blood? Or?
I think it just depends on our health in general. So we've mentioned from all the evidence that we have and put together that around 80% of individuals actually do very well. And it is those individuals that actually do not have comorbidities. So the risk factors for you getting moderate to severe disease, especially severe disease, are those individuals that are obese, have poorly controlled asthma, have poorly controlled hypertension, have poorly controlled diabetes, or are severely immunocompromised for whatever reason. For example, if you're on immunosuppressive therapy or you have cancers. So if unfortunately you fall into that bracket, it's going to put you at increased risk, because more especially it's not just a respiratory disease, even though your respiratory system is involved. If you already have predisposed damaged lungs, then you're going to do very poorly. In those individuals, we actually find that SARS coronavirus or the disease COVID-19 actually causes a severe inflammatory response in them, and they've called it the cytokine storm. So besides the acute respiratory distress syndrome that some of these individuals are experiencing, they also experience inflammation in different parts of their bodies. So besides them having pneumonias, ARDS, and ending up on the ventilator, some people even present with strokes or emboli, which are blood clots in different parts of their body. So it's basically a multi-system disease.
So would you agree with me if I said that, actually going back to the first question that I asked you, which I will share now, is that, are you saying that if we did not have people who were obese, who did not have diabetes, those people will probably now survive COVID-19? So in other words, if we went back in time and we treated CVD, diabetes, as pandemics and worked hard to ensure people don't have all of these issues, that they could have actually done better now.
Perhaps, but I think that all of us in the medical fraternity, both locally and internationally, are putting a lot of effort into making sure that our patients have well-controlled hypertension and diabetes. But remember, it could be genetic causes that they're actually diagnosed with these non-communicable diseases. And I think what the most important thing, that these are lifestyle diseases as well. If you're not maintaining a healthy life, exercising, getting adequate sleep, and having nutritious meals, there's no ways that your disease is going to be controlled adequately.
But should we not be forcefully, even though this kind of goes against human rights and just having a freedom to do what they want, but just having the freedom to eat whatever you want and do whatever you want, to drink and smoke and whatever it is, eat really nasty food, is now having an impact on the whole world, because those are the people that are more at risk for...
Well, ultimately, I think all of us are there to control what we actually do for ourselves individually, and in essence, it has to be a team effort with everything in life.
Yeah, of course. I think what I'm really trying to say is, maybe we should, take the same seriousness towards finding a cure for heart attacks, for diabetes, all of those things, because we are just interested in most doctors are just interested in giving somebody a prescription instead of working to find a real cure towards...
I'd like to disagree. I cannot speak for every other medical professional out there, but I think majority of us as medical professionals treat our patients holistically. So it's not just issuing somebody a script and telling them to eat these pills. We look at the patient and their families holistically. So I'd have to disagree with you on that. And there's been lots of research, ongoing research, like for many decades regarding all these other non-communicable diseases. And as a medical professional, I like to say that even though everybody's concentrating on COVID-19, we're also concentrating on other non-medical lifestyle changes that people need to introduce into their life, and also diseases that are not COVID-19 related. For example, we are trying to encourage our patients to still, for me as a pediatrician, still come to our rooms for their well baby checks, for their vaccines, because remember, we need to try to prevent them from picking up any of the other diseases. We don't want there to be outbreaks. For example, there was an outbreak of measles in one of the other countries because people are not going to get their well checks done and their vaccines done.
If I had to now get COVID-19, will my medical aid actually just pay for that, or is that not covered, or is it covered?
No, the medical aids are paying. If you meet the NICD criteria for SARS coronavirus 2, yes, your medical aid would pay for it.
Okay. Are we ready in South Africa for the surge that's about to happen in our country? Are the beds, do we have enough beds? Do we have enough space? Do we have enough doctors?
Okay. So I think the lockdown has allowed all healthcare facilities, whether it's state facilities and private healthcare facilities, to try and equip our hospitals as best as we can. The government has also come up with field hospitals in different areas to try and cope with the surge that has already started to come. So I think we are prepared as best as possible. Do we have enough doctors? I don't even think before the COVID-19 pandemic we had enough doctors. Remember, during this pandemic also, there are quite a few doctors, especially I know in private practice, who are elderly, so are in the more vulnerable risk. So they have chosen not to practice clinical medicine. There's a lot of doctors also have serious comorbidities, and therefore they would be at added risk if they were to pick up COVID-19, so they have opted not to do clinical medicine. And then there's a lot of healthcare workers in all, both private and public healthcare facilities who actually have COVID-19 currently, so they would be off if they have very mild SARS coronavirus 2 symptoms. They'd be off for 14 days. If they have more severe or serious disease, they'd be off for a longer time. So I don't think we're ever going to be at that stage where there's going to be enough doctors, but all of us are prepared for what's going to come.
Do we need more doctors, or do we actually need more nurses? Because nurses are actually more
hands-on and engaged 24/7 with the patient. I think we need both. Definitely both. Yeah.
Because we did bring in some doctors from Cuba.
Yes.
But nobody ever said, okay, we are going to bring in some nurses from Cuba or anywhere else.
I don't have the actual numbers, but definitely there are. I think all the provinces have put out adverts for more staff, even people that went into early retirement, or people that are not practicing. We've also heard of GPs, especially in the Western Cape, that are now going in to help the hospitals. So they've thought of different ways in order to get everybody who has the skills that are needed in a medical facility to come in and help.
So there are really two ways in which we can combat this COVID-19, two ways in which we can safeguard ourselves. One is to find some kind of cure for this, or the other is to boost up our immune system. What are your thoughts about some doctors who are telling their patients to try taking, like, say, vitamin A, D, and C? Do you also prescribe to that kind of thinking, or?
So I think as doctors as a whole, we all are supposed to practice evidence-based medicine, okay? Current evidence-based medicine. And even though you're alluding to the fact that not many doctors believe in vitamins and minerals boosting our immune system, majority of us actually do believe in that. There's no cure for SARS coronavirus 2, so all our facilities have COVID task teams, and they've come up with modalities of care or bundles of care. And vitamin C, vitamin D especially, and zinc are actually part of those modalities of treatment that our SARS coronavirus patients are being treated with. There's plenty of evidence and research that actually shows that vitamins and minerals specific to vitamin C, vitamin A, vitamin D has helped decrease the symptoms of the common cold and influenza previously, so we're postulating they may have the similar benefits with SARS coronavirus too. So yes, in my practice especially, most of my kids as an immune booster would get zinc, and those some of them will even be on a multivitamin every day.
You are actually part of a group of doctors that are very rare to find that are actually taking this holistic approach. I know you said that you are actually part of a circle of doctors that treat patients holistically, but my own reading and my own observation tells me that many doctors out there are just wanting to give a patient a pill. So you are saying that actually no, they're not interested in just giving people.
No, I'd like to believe that every doctor is very similar to me in the thinking that we manage all our patients holistically.
Because am I right to say that when you are studying for your degree, nutrition is like a small part of your studies as compared to everything else that you...
No, I think we learn everything in our curriculum. We actually learned how to manage patients holistically. It was a major thing for us in our medical curriculum, our undergraduate curriculum, and even our postgraduate. We have to manage patients holistically, starting at primary care level.
Okay, that's interesting. I don't agree, because my experience or my own research has showed me that the pharmaceutical companies want to sell more drugs.
For sure.
And they don't want to have patients, people who are well taking vitamins and minerals, because that's cheap,
Yeah, you're looking at it from a business perspective, but our aim as physicians or specialists or even a general practitioner is to make sure that we keep our patients as healthy for as long as possible.
Absolutely. But I know let's not get into too much of a conversation with this, because I know that some doctors, and this is not labeling all doctors now as bad, but doctors want to keep their patients coming back for more of these drugs so that they can actually sell them more of these drugs. But I suppose this is not actually part of that conversation. So Africa is doing really well, as compared to the rest of the world. Why do you think that is the case?
There's different postulates, like there was some thinking that maybe the mandatory BCG vaccine that everybody in Africa does receive is protective. There are currently studies being done on it, but I cannot comment more than that. So we don't know if that's the reason. I personally think that Africa is highly at risk of patients doing very badly with SARS coronavirus too. We have a very at-risk, vulnerable population in terms of the socio-economic dynamics of our country. We have a high rate of HIV, we have a high rate of TB. Besides that, majority of the pockets of population that we have actually live in very poor socio-economic circumstances. There's overcrowding, lots of people, or the majority of our population actually live in townships or areas where there's overcrowding. Even as if they try to social distance, it's very difficult. There's a pocket of our population that does not have access in this day and age to proper water and sanitation. So even if they want to do hand hygiene, it's very difficult for them. So I think it's just a matter of time that the numbers are going to increase. We are currently seeing, this week even, we're seeing the surge in cases. We haven't hit our peak just yet. So it's just a matter of time. It's just geography of how this virus is working.
Our country is actually very special in that, well, not in a good way, in that we have a high number of HIV positive people. How come during the flu season in this country that we don't have a surge of people in the hospitals?
Okay, we're actually getting a surge of patients with SARS coronavirus 2 at the moment, not so much influenza, and there's many reasons for that. we have actually been receiving data from our private labs on the number of infections that we saw last year compared to this year, and they markedly decreased. It is influenza season now. For us as pediatricians, we also see a lot of RSV, which is respiratory syncytial virus, and that's down as well as other common viruses such as rhinovirus and adenovirus. All these viruses are down. There's many reasons, like I mentioned. One is we were in lockdown, so businesses were closed, schools were closed, people weren't going out in the community. So a virus can only spread if we are the vectors and we walk around and spread it. Okay, so that's the one reason. The other reason is that people are wearing masks universally. Okay, so there's decreased risk of you spreading the virus if you are wearing a mask. Any virus, not just SARS coronavirus 2. And also because the signs and the symptoms of SARS coronavirus is very similar to influenza, there has been a massive uptake of the influenza vaccine this year as compared to last year. So the number of influenza cases will definitely be down for all those reasons, that people are currently not being admitted with either influenza A or influenza B. Then you spoke about the number of HIV positive patients we have in our country. Yes, we do have a lot of HIV positive patients or patients with TB. But remember, if these individuals, even though they're classed as immunosuppressed, if they are on the correct antiretroviral regimen and their viral loads are suppressed or undetectable, they are no more at increased risk of picking up any infection or opportunistic infections as the general population.
Okay, that's really well answered. If we look at Singapore, Singapore has very few deaths. Why are they doing extremely well?
Okay. I don't think we can compare our country to any other country, but in saying that, our population is around, I stand to be corrected, about 57 to 58 million, and Singapore is only about 5.7 million. So I think you cannot compare in terms of that. And then I also spoke about our country being a third world country and the socioeconomic dynamics in our country being completely different compared to Singapore, for example. They'd be classed as a first world country, I think. So I don't think you can compare numbers in that case. I think we would be more at risk of having numbers, and with such a low population, I won't be so impressed with them anyways, having that number of deaths and number of infections.
So this is not going away, right? This is not going away anytime soon. We have to learn to live with this world.
Exactly.
If we actually live through it. But how do we actually deal with this now? I mean, surely we can't stay in our homes locked up forever.
I agree with you. So we are all for the initial lockdown that came about and the regulations that came about because it allowed us time to prepare our healthcare facilities, prepare ourselves, like we mentioned, with PPE and equipment and training. It allowed also more time for research into vaccines and medications to try and cure coronavirus or SARS coronavirus 2, which is currently still underway. But in an ideal world, I would have wanted the lockdown to be strict and rigid and draconian-like, but our country does not have the facilities or the infrastructure of economics to allow that to happen. I think most countries worldwide do not have that. So we have to start opening up our economy, relaxing the lockdown regulations, try and let people go back to the new normal, while still knowing that even though the lockdown rules are being relaxed, SARS coronavirus is not going anywhere. You're still just at the same high risk of picking up the virus if you do not try and prevent it. Remember, even if you try and do all the things that we are telling you about, you still may be at risk of picking up SARS coronavirus. But stick to the rules, because you don't know how your immune system is going to respond to this virus, especially if you're in the vulnerable group. So I would still encourage people to social distance, wear masks, and hand hygiene.
But how effective are those masks?
Okay, so there's different masks for us in the healthcare facilities. If we are doing invasive procedures that are going to induce aerosol, like intubating a patient to put them onto a ventilator, or even if they're being nebulized on high flow nasal prong oxygen, there's lots of aerolization in the rooms. So we would wear the N95 mask or respirators, which is not 100% protective, but it gives us about 95 to 96% protective and is from picking up viruses such as SARS coronavirus and even TB, for example. The surgical masks have filters in them or more layers that actually protect you from picking up any virus, including SARS coronavirus, but it only gives you about 60 to 65% protection, okay, for us as healthcare workers. But those are the two masks that healthcare workers should
65%.
should be using in a hospital facility, okay. For the general population, there's lots of picturizations or diagrams and videos online that you can even go on and look at, where if you look at the aerosol particles or the droplet particles that come out just from us speaking or screaming or talking or even coughing, if you wear nothing, you can see there's a lot of particles that you'd see. But if you wear a mask, it actually shows. I actually watched a video yesterday, it actually shows there's nothing that comes out. So just a simple 3-layer fabric mask is protective. Can
actually help.
By me wearing a mask, I'm protecting you from picking up viruses or bacteria. By you wearing a mask, you're protecting me. So it makes a huge difference. And by social distancing, you know, SARS coronavirus is spread predominantly by droplets. So we have droplets usually as you're speaking or talking or singing or whatever it is, will go as far as about 1 or 2 meters. Sometimes it can even go as far as 6 meters, depends on how loudly you are screaming. If you're wearing a mask, you're actually decreasing that. And if you're staying far away from that person, at least 1.5 to 2 meters, you are decreasing your risk of picking up that virus.
But if we are in a mall, and if I sneeze from the other end of the mall, there's still a chance of that sneeze reaching you.
So it depends. Ideally, you'd be wearing a mask and I'd be wearing a mask, so we'd be protecting ourselves from inhaling this virus, okay? Remember, it depends on how far, if you weren't wearing a mask, how far your droplet went. It also depends on the dose of the viral load. Remember, you are most infectious when the actual viral load of your virus is very high. Those are mostly the symptomatic patients or people that have SARS coronavirus, or if you have severe disease, then your viral load tends to be higher for longer. But usually for SARS coronavirus, your viral load is very high just at the time where you're symptomatic. But in saying that, there have been lots of asymptomatic positive SARS coronavirus patients or pre-symptomatic patients as well.
Right. If I was involved in a motorbike accident and I had some kind of head injury and I came to you, would you then give me a helmet to wear? After I hurt my head, would you then give me a helmet? Yes or no?
Well, first of all, I won't be treating you because I'm a pediatrician.
Well, if I was 6 years old and I came to you and I had a head injury as a baby, just a yes or no, because there is actually another question to follow up with that. You wouldn't give me a helmet to wear, right?
To protect you from further head injury?
To protect me from the injury that I now have. No, it makes no sense, right?
Yes.
So my question is this: why is it have we banned smoking in this country? Because surely people that have been smoking for years and years and years have already damaged their lung in the same way that I would have damaged my head. So does it make sense that we should now ban smoking, claiming that we are going to now protect these people who are smokers from getting COVID? Is there any truth to that, or is there any science to back up the banning of cigarettes?
So I think the actual aim or the intended aim of banning cigarettes is because if you're a smoker, you already have damaged lungs, and therefore you're at increased risk if you have to get SARS coronavirus to a COVID-19. Then you will experience the more moderate to severe effects of the COVID or complications of COVID-19 because you've got background damaged lungs. So that, I think, was the only reason why they would have banned cigarettes, because they want to prevent smokers from further damaging their lungs.
But it's damaged already.
Okay, I get you. So I think that was the only reason why they would have banned it. I am against smoking. I do not smoke myself.
Same, yeah.
And I have seen the actual adverse events of passive smoking on the kids that I manage in my practice as well. I don't personally agree with the actual fact that cigarettes have been banned. I actually would have had or preferred that they actually ban alcohol, because that's actually putting on more strain on our healthcare facilities.
Absolutely.
And I think the actual ban of cigarettes is actually putting smokers at increased risk, in my opinion, of picking up SARS coronavirus, because businesses have closed down, people are not earning any income or have had their incomes cut. But because they're still addicted to the nicotine or tobacco products, they're still going anywhere they can to purchase this at exorbitant amounts of money, okay? Instead of trying and saving that money for things that are really needed at this point in time. Because cigarettes are so expensive, I think they would be even considering sharing the cigarettes. You know, like our minister had said, she does not want people to be sharing, but I think now's the time that they probably will share it because it's so expensive. That's increasing their risk of picking up SARS coronavirus. And the other thing is some people, because they cannot afford the cigarettes, because it's so expensive to buy it illegally, they have actually started using alternative methods and alternative things to smoke. And these are chemicals that will actually cause more damage to their lungs. So I'm actually against the tobacco ban, even though I believe in totality that tobacco is bad for you and your health.
Yeah. Well, if it was up to me, I would ban cigarettes around the world. But at the same time, you know, we can't just take away the cigarettes from the people if there's no science to back it up. We are the only country now in the world that has this ban of cigarettes. Previously it was South Africa, Botswana, and few states in India. But at this moment, we are the only country that has this ban, and nobody has given any explanation as to why this is the case. So I suppose that is for another conversation to actually be had. Some countries have had no lockdown and they are doing actually okay. For example, Sweden seems to be actually managing. What would have happened in this country if we had no lockdown at all?
Okay, I definitely believe that the lockdown is warranted, and I told you in an ideal world I would have continued with the lockdown until we come up with some sort of cure or vaccine. Like I mentioned, I don't think we can compare our country, which is a third world country, with a great deal of differences in the different pockets of our population, especially socioeconomically. If we did not have a lockdown, our numbers would have been much, much higher. Our mortality rate, in my opinion, would also have been much, much higher. I think even though we did not flatten the curve as we thought would happen, definitely it would have been much worse than what it currently is. I think social distancing, universal masking, and reiterating hand hygiene has played a huge role. We definitely are going to see a surge in the cases because not everybody is practicing what we're preaching. And as the lockdown is being eased, there will be an increase in the number of cases. And I think ultimately, almost all of us at risk, no matter what we try and do, until there's a vaccine or a cure for SARS coronavirus.
When can we expect a vaccine? I know that's not an answer that you may have, but from all the reading and research and all of the Zoom calls that you've been on, when do you think it's most likely we may get a cure?
My personal opinion is that there's lots of activity going around. Usually vaccines take many, many years by the time they trial it and test and see that if it's efficacious and safe, and then they manufacture and distribute it. But now people or companies are doing all these multiple things in one go to try and get it out as far as possible because of the socioeconomic effects of the actual virus and the fact that lockdowns have had on the economy of countries. So I would predict definitely in the next year.
I'm actually really curious. If there is a vaccine, who's going to pay for that vaccine? Will our country have to pay for it? Would each country have to buy?
I'm not sure how it exactly is going to work, but definitely I think all countries are not going to have a problem to making sure that everybody gets an equal opportunity to have the vaccine, but definitely all the at-risk or most vulnerable population would be first priority for getting the vaccine. I think even the vaccine trials are trying to get vulnerable populations in the vaccine trials, so you see how they respond to it. Basically, you don't want very well people going and taking this vaccine and then it works beautifully on numbers and papers. You want to see what happens to the actually at-risk vulnerable group.
Are you able to share how these vaccines are actually working? Are they coming up with a cure that's gonna where they're going to give us a very weak form of the virus, or maybe even parts of the virus, or is there some kind of antibody that's going to be injected?
So there's a whole lot of different things that are going on at this moment in time. There's lots of studies going on where people that were actually SARS coronavirus 2 have donated their blood, and
Yes.
the antibodies from their plasma were taken, and they're doing research regarding that. I can actually comment a little bit on the actual vaccine that we are trialing in South Africa at Wits University. I don't know too much about it, but from what I've read, they've actually taken a weakened strain of adenovirus, which is a common virus that we see that's non-replicable, and they've engineered it such that they've produced the spike protein that we actually see on SARS coronavirus 2 that attaches to the ACE2 receptors. So that's the way that vaccine is going to work. But there's a whole lot of other vaccines that are going around, and depending on how individuals respond to that actual vaccine in mounting an immune response, whether that immune response lasts for a lifetime, we don't really know. We'll just have to wait and see what happens.
Yeah. There's a lot of unknowns here
For sure.
with COVID. Doctor, thank you so much for really making time to just sit down with me and answer all of my questions. It's been really insightful. I've learned a lot from just having a chat with you, and I hope you guys have also learned so much about COVID-19. So if you actually enjoyed this conversation and you learned a lot, please share it with your friends. And I'll see you again on the next episode of Luminous Wisdom.